In this episode of the Nurse Practitioner Podcast, Dr. Molly Bachtel and Dr. Michelle Nelson discuss healthcare and nursing in Georgia amid the COVID-19 pandemic. A survey released by the Georgia Nurses Association found that 4 in 10 nurses don't feel safe or equipped to perform their duties amid the coronavirus pandemic. This is down from 70% who felt unsafe not long ago, but it is still a high percentage. What are the ongoing issues that are making nurses feel unsafe?
Well, PPE was found to be the main cause for concern among nurses. Survey respondents said they are reusing N95 masks for 2 to 3 weeks at a time, even 2 months in some cases. Many are also making their own gowns and disinfectant wipes. The rules on PPE seem to have changed on a daily basis, and those implemented seem to be based on what's available rather than what's safe.
What is your experience with PPE shortages, and how do you think this can best be addressed?
Well, at my outpatient clinic in a student health service, I have been using the same N95 mask for 6 to 7 weeks. I haven't been reissued a new one. I do have a second mask I put over the N95 when I need to wear it. But mostly on the outpatient side, we're transitioning to doing a lot of telehealth to limit our exposure and triage people by phone. We have a lot of younger people who are sick with COVID-like symptoms. And, first testing really wasn't available. So we're just giving advice on self-isolation and how to care for themselves, because in my whole population, nobody's been hospitalized out of all our students who've had COVID symptoms. But as testing has improved, we're getting people in for testing at a nearby testing facility and sometimes bringing them into our facility as well for testing where we are using our PPE.
Governor Brian Kemp said in a press briefing that Georgia now has a decontamination unit that will allow reuse of N95 critical masks. Are you seeing any progress due to this?
In my outpatient clinic, I haven't heard where we are recycling our masks, but I imagine on the inpatient side that people are taking advantage of that opportunity. They're calling it the Critical Care Decontamination System, or CCDS, and they're using a concentrated hydrogen peroxide to decontaminate N95 masks. I also have had colleagues share with me some personal devices. They're almost like a little pouch you plug in that use UV light to decontaminate any object. You could use a mask. For about a year, we've had this little UV oven at my pediatric emergency room job I have that I work at once or twice a month. And of course, there's a shortage of purchasing those kind of things if you don't already have one at your facility. But I am seeing those are being used. The capacity on the system the state of Georgia has rolled out is 80,000 N95 masks per day can be decontaminated, and they can do it for up to 20 times without degrading the performance of the mask.
Another issue that has been reported is improper screening of patients before they are brought to the floor. Asymptomatic patients may go to the hospital for issues other than COVID-19, but tests later reveal that they were COVID-19 positive and exposed to healthcare staff who were not adequately protected. Shouldn't all patients be screened before they see nurses and doctors? Is this possible to do?
Well, I think a lot of improvements have been made. When we were first doing the COVID testing, for me on the outpatient side, we had some people waiting 11 days for results, so that wouldn't help at all in the inpatient side of things. But now they have much quicker testing available that is a matter of hours where they can get some results. But in the meantime, while you're waiting on test results, you have to assume people have it until you prove otherwise. And that's where, there's able to kind of triage the patients coming in, because obviously other people are still having other health issues besides COVID, and they need care, and we need to protect the healthcare workers. We know, like with planned procedures, elective procedures, there is a way we can prioritize the testing and get them in for screening before their elective procedure, or let's say a woman's having a baby but by C-section, that's planned out, they can do that ahead of time. But if it's something unplanned, then they're going to have to assume somebody's positive until proven otherwise, and then not just wait on the test and also monitor for symptoms.
Georgia has the 5th highest nursing shortage in the country. Previously, the State Department of Health declared that Georgia's nursing shortage had reached a crisis level, exacerbated by low wages and retirements outpacing new recruits. To make matters worse, during the pandemic, states like New York have been recruiting healthcare workers from around the country, including Georgia. What should Georgia be doing to keep its nurses in the state to help Georgians?
It is absolutely imperative that Georgia put multiple things in place to retain the nurses in the state. One of the biggest issues that we have, of course, is wages that are much lower than other states. For instance, I'm from New York, and as an APRN, I get paid tremendously more than what is paid here in the state of Georgia, which is absolutely not keeping pace with increases in things that we spend our money on every day. So absolutely making sure that wages increase to match what things cost in the state is absolutely imperative, as well as making sure that there are enough jobs. I'm proud to be a professor at Georgia State University, and a lot of my students do report to me that it's difficult to find jobs, particularly if you are an advanced practice nurse. So many of the students are able to find jobs when they come out as undergraduate students, but our APRNs are finding it particularly difficult. Why is this happening? Because in the state of Georgia, in order to work, especially if you are a nurse practitioner, you are trained to work in a primary care community setting for the most part. And in order to do that, you have to be able to find a physician with which to have a protocol agreement. And if you're not able to find one, well, then you're not able to be employed. And particularly, you're not able to open your own practice. In the state of Georgia, where the majority of it is rural, it is difficult to find employment, particularly in our rural areas, because there's a lack of physicians in those rural areas with which to have protocol agreements. So for nurses on the whole, making sure that there are not restrictions on practice that prohibit you from being able to provide care, as well as engage in what we consider to be the American dream of being able to open a practice and to flourish. So we want to make sure that restrictions are lifted and that advanced practice nurses have places to go where they feel valued and can contribute to providing optimal health care for our state.
The Georgia Nurses Association has stated that it is working with the governor's office to come up with ways to prevent nurses from leaving Georgia, such as student loan forgiveness programs and increased workers' compensation. Shouldn't there be other things on their list, such as relaxing restrictions on APRNs?
Well, first and foremost, let me say I'm very proud of our Georgia Nurses Association for taking the time to devise mechanisms that pinpoint advanced practice nurses, as well as RNs on the whole, things that can be done to retain our nurses here in Georgia. So most certainly, tackling things such as workers' compensation and student loan forgiveness programs are absolutely vital, because we have an issue with a lot of our nurses here in the state who have been fired and furloughed. And so we want to make sure that they're being taken care of in terms of finances. But there are other things that have been discussed, such as providing a death benefit. And I know that it's not something that's an easy topic to discuss, because you don't want to think of nurses and decreasing their morale of nurses by discussing things such as death related to practice. But it is something that does happen. And most certainly in times of a pandemic, this is when it becomes a lot more apparent. We have lost a nurse here in Georgia while working on the front lines of pandemic. And if you ask me, that's one nurse too many. So what happens to that nurse's family? Nurses have been heroes and will always remain as heroes. We are the number one trusted profession 18 years running. And in 2020, the year of the nurse and the midwife, it is very important that we understand that not only nurses and the sacrifice that they make should be recognized, but as well the sacrifice of their families. So if something happens to a nurse, You want to make sure that their families are cared for in the line of duty. It is done for other professions, such as law enforcement, and we want to make sure that our nurses are regarded and treated and revered in the same way. We also want to make sure that nurses are receiving resources to be able to deal with their mental health. Now, I can say that I really don't care what industry or profession you are in. If you are on the front lines seeing the morbidity and mortality that nurses are seeing on a daily basis, is going to affect your mental health. So making sure that there are resources available to be able to help nurses process their feelings, their emotions, to give them the strength and the courage to continue to do a job that is very difficult to do. There have to be resources in place, and not just a phone line where you can call in, but actually physical resources. If you're in trouble in any particular place, that you could dial a number and someone comes to get you, or if you're in crisis, or is able to provide resources that are needed. So I definitely would like to see more done on that front, and it is possible.
What have groups like the United Advanced Practice Registered Nurses of Georgia and the Georgia Coalition of Advanced Practice Registered Nurses been doing to enable APRNs to be able to contribute to the full extent of their capabilities and training? What more can be done?
United Advanced Practice Registered Nurses is the premier organization in the state of Georgia that represents all advanced practice nurses. I am the proud state president of United Advanced Practice Registered Nurses, as well as the co-director of the Coalition of Advanced Practice Registered Nurses, which functions as the legislative arm for all of the advanced practice nurses organizations in the state. We have been doing a tremendous amount of work over the past couple of years to do quite a bit of things, such as role delineation for advanced practice nurses, because sometimes people still don't have a grasp of what a nurse practitioner does, and you have to educate them on what the role is. We also engage in a tremendous amount of community service, as well as we have multiple events and a large conference and many conferences throughout the year. UAPRN has 18 current chapters across the state. And so there's a tremendous amount of engagement within the community. So one of the things that we're really focusing on a lot now is our legislation, being able to move our legislation forward. In the past couple of years, we've really focused on removing restrictions on APRN practice, and now the pandemic has really brought into focus the fact that these restrictions prohibit us from being able to provide the highest level of care, such as opening pop-up clinics in various areas of Georgia to be able to test people who may possibly have the virus, as well as provide primary care. And so during the pandemic, after we reached out to the governor's office, we started a campaign. The campaign is called Georgians United for Healthcare. And this campaign focuses on a multiplicity of things. The most robust one that we're working on right now is HB 1092, which is focusing on removing restrictions. It allows advanced practice nurses to be able to order advanced imaging, and that is CAT scans, MRIs, nuclear imaging, and PET scans. And it also allows advanced practice nurses to work with physicians with a higher ratio. Currently, it's 1-to-4 ratio of physicians to APRNs working in a primary care setting, and we are seeking to increase that ratio for 1-to-6, and that translates into more clients, patients, individuals, communities being able to access care in the state. Some of the other things that we really want to see done that are going to help Georgians increase access to care is a full removal of the restrictions. We're looking for full practice authority in our state, which would allow us to be able to go particularly into the rural areas where there is such a lack of health care. In 9 counties in Georgia, we don't have any type of access to health care in terms of physicians or pediatricians. Maternal mortality is very high. We are near the bottom when it comes to outcomes for maternal mortality, and we need to do better when women are driving 80 to 100 miles to get maternal care. And so it is absolutely imperative that we continue to work on our slogans that we have put together and to get them out to allow the citizens of Georgia to understand that, Georgians United for Healthcare is really delivering an opportunity for us to be able to do the best that we can. Ready, willing, and restricted is our slogan. And we are asking that they untie our hands to be able to deliver more. Georgians United for Healthcare has been very fortunate in that we've had multiple organizational partners sign on to our campaign. We have big partners such as Americans for Prosperity, the Institute for Justice. The NP Journal has been very kind in helping us to spread the word. The Georgia Nurses Association. We have multiple APRN organizations such as the South Georgia Nurse Practitioner Organization, the Pediatric Nurse Practitioner Organizations. And we are continuing to seek more organizational partners to be able to spread the word in our awareness campaign. I really implore everyone to share this message. We are focused on making sure that citizens of Georgia are aware of what's happening with healthcare in the state. Our focus is to make sure that everyone is receiving optimal healthcare, not as a privilege, but as a right. And nurse practitioners need to have their hands untied to be able to do their part in helping us all to access optimal health care.
This podcast does not constitute medical advice and should not be taken as such, and does not replace professional judgment or advice. The ideas and viewpoints expressed in this podcast do not reflect the official position of the speakers, authors, affiliated organizations, the Nurse Practitioner Journal, or Wolters Kluwer.